Why do doctors measure post-void residual volume? Have you ever wondered why doctors measure post-void residual volume? This measurement is important for understanding how well your bladder is functioning. When you urinate, your bladder should empty almost completely. However, some people may not fully empty their bladder, which can lead to health issues. By measuring the amount of urine left in the bladder after urination, doctors can assess bladder health and diagnose potential problems. One key reason for measuring post-void residual volume is to evaluate how efficiently the bladder empties. Normally, a small amount of urine, usually less than 50 milliliters, remains in the bladder after urination. If the volume is larger, it may indicate urinary retention, meaning the bladder is not emptying properly. This can signal issues like bladder dysfunction or an obstruction. Doctors also use this measurement to diagnose lower urinary tract symptoms. If someone experiences difficulty urinating, frequent urination, or urgency, measuring post-void residual volume can help identify the cause. For instance, it can differentiate between bladder outlet obstruction, which may occur due to prostate enlargement, or impaired bladder muscle function. Another important aspect is that a significantly high post-void residual volume, often above 200 to 300 milliliters, can indicate serious bladder dysfunction. This information can influence treatment decisions, such as whether invasive procedures are necessary to address bladder outlet obstruction. It can also help predict the risk of complications, like urinary tract infections or bladder damage from urine retention. In specific conditions, monitoring post-void residual volume is crucial. For patients with recurrent urinary tract infections or those with neurogenic bladder, measuring this volume can help detect problems early. It is also useful in monitoring bladder cancer patients or those who have undergone surgeries affecting the urinary tract. The measurement itself is typically done using bladder ultrasound, which is a non-invasive method. This makes it a practical tool for repeated assessments in a clinical setting. In the context of bladder health and bladder cancer, measuring post-void residual volume is essential. Incomplete bladder emptying can lead to urinary stasis, increasing the risk of infections and complicating bladder cancer symptoms or treatments. By keeping track of post-void residual volume, doctors can ensure that the bladder functions optimally and detect any dysfunction early. In summary, doctors measure post-void residual volume to assess how well the bladder empties, diagnose urinary issues, guide treatment decisions, and monitor bladder health. This measurement is a standard part of evaluating lower urinary tract function and plays a vital role in maintaining bladder health, especially for those at risk for or being treated for bladder cancer.